All right, what's going on, peeps? This is Nurse MJ, and I'm going to shoot and do this really quickly, hopefully, because I can get long-winded. But I wanted to come on here and just share my journey as I am preparing for an ovarian cyst removal, as well as having my fallopian tubes removed. And so if you see the title, it says ovarian cystectomy. That is basically the medical name for removing ovarian cysts. And then I will also put in there opportunistic salpingectomy, and that is basically having the fallopian tubes removed at the same time as the ovarian cyst. And so in basically leading up to this, it's been months and months as far as with the cyst that was growing on my ovary. In terms of the fallopian tubes, it was a discussion that I had with my nurse practitioner and eventually the surgeon that is going to handle the procedure. I had a discussion with both parties a while ago about what I could do in terms of birth control. I'm currently on a pill, very low estrogen, but with any type of hormone therapy, you do, as far as in my family history, any type of estrogen or hormone shows and has carried a risk of developing breast cancer. And so because it's so heavy on both sides of my family, I had to put a lot of things in consideration, which is why I'm on low estrogen. And I don't really take any other ones because of their very high levels of estrogen. And I don't want to put like an IED and the thing in my arm. I don't want to do all of that. That's just too much. So I decided after a year of contemplating on that, that eventually I was going to get to it. But lo and behold, a doggone cyst appears on my ovary. Okay. And I've had them in the past. Typically, they would just go away and it'll dissolve and do whatever. But this one in particular decided to keep on growing. Okay. It was, at first, they found it after I kept going to the urgent care, trying to figure out why I was having the urge to go, and couldn't quite, grab a hold of it. Hold on, let me get some seasonings because I'm actually making a shrimp stir fry right now. So hold on one second. I'm getting that for my kids. Just a couple of seasonings because the rest of it is going to be in the actual, the seasoning is going to be in the sauce that I made. But I know you ain't come here for that. So lo and behold, there was a cyst. After I went to a urologist, he checked it out. He was like, interesting. Did you know that you had a cyst on your left ovary? And I was like, I do. And I was like, again? And so when I went to go to my GYN practice, family practice, women's practice, they said that it was measuring at about 6 centimeters. So what they wanted to do after that, they said, and when I went to the urologist actually said that there was nothing really wrong with my bladder. There was nothing wrong with my ureters. There was nothing wrong with my kidneys. Everything checked out. But when they imaged, the kidney area is when they saw that it was sitting. That it was sitting there. So I was like, OMG, what in the world? Why is that there? Okay. And so I went ahead and, like I said, I went to go get it checked. And they were like, okay, it's about 6 centimeters, but what we're going to do is we're going to get you checked out in about another month, just to make sure that it's either going to grow or it's going to go away. Because typically at a very smaller size, they go away. And women, as we ovulate, we grow cysts, and then they're called follicular cysts and things like that. So when they checked it, my cyst was filled with fluid. So it wasn't nothing as far as cancer, no tumors, no dermoids, no nothing like that. So we're, everything is so far so good. So I kept going back for those checks, and I went back in about 3 months. And at that time, it had grew another centimeter. So they still said, okay, are you in any pain? I said no, which I wasn't. Are you, any symptoms? So being a nurse, I kind of, obviously know a little bit about the process and how it goes. So I'm one of those ones that just, I'm going to go, I'm not going to, I'm not going to say no. I'm not going to just, oh, it just, no, it'll go away. No. If I knew that it was having like I was having severe pain, I was having bleeding and all that other stuff, I was going to the emergency room, plain simple. So if you have a cyst and the cyst is painful, if it is, if it's causing, if it's very severe, and if you start to see any bleeding with it, you need to go to the emergency room, okay, if you're in that watchful wait. But I said, no, I'm good to go. And so we waited another 3 months. So around that time, it had actually stopped growing. So I was like, all right, cool. And so they was like, all right, do you want to come back in another 3 months? At that time, she did kind of suggest, go ahead and, get it removed. Again, the discussion about the tubes came up as well, because she was like, well, if I do take this, if you decide, or if that cyst keeps growing, I can do the procedure and take out the tubes at the same time. So I was like, word? And so she was like, yeah, two birds in one stone. I was like, okay, well, let's keep watching it. Let's see what happens on the following month. And so, the following follow-up. So I did the next follow-up, and it kept growing. And so now it is at a size 9, about a 9.5. And to put it in perspective, a 9.5, 10, okay, if you're in between that area, that's about the size of a newborn's head if you're carrying a fetus. A newborn before it's born. That's the size of the head. Okay, let's just put it like that. So I don't have any pain. I think because of the size of it, I do experience some issues with, still having some trouble with my bladder. And also, I also have existing digestive issues. Like, one of my doctors told me I have IBS. So what I think it's also doing, and of course the things that I eat, it does play a factor. And so it's just one of those things where I have to, also consider that. But I think it is starting to affect my bowels. Okay, it's making me a little bit more constipated, or just having trouble moving my bowels on a daily basis. Okay, so those are some of the symptoms that I experience. And I'm very aware of my body. And so if that is some of the things that you are experiencing currently right now, and you've never gotten it checked out, I highly encourage you to go to your OBGYN or your GI doctor to rule out either one, whether it's a digestive issue or whether in fact you do have a cyst sitting on your ovary. But a lot of times with the cyst, it's they'll say there'll be pain on the same side of it, and it's or you could experience any issues with urinating. So I'm glad that they found it. Okay, and I'm glad that I'm one of those ones that I do not wait. I do not sit around and pray that it goes away. I'd rather check it out. I'd rather be safe than sorry. Okay, you don't want to be sorry. You want to be safe. All right. And so now we are about 4 or 5 days out until the procedure, and it's going to be done laparoscopy. It's going to be outpatient, which is great. I am still a little nervous because this will now be the 4th procedure that I've had. I've had 2 C-sections and an umbilical hernia repair. I have a mesh in place, and so they got to work around that. I constantly talk to the surgeon, who is also an OBGYN, and I've asked her, what is her expertise in it. She's very well trained, and actually she's hands in deep with it. Okay, she's done this so many times, and just with our conversations, she's told me that this is how it's gonna go. She literally walked me through how the whole process goes. So in another video, I'll obviously when it's post surgery, I'm gonna share my scars and give you the outcome of how it is. I'm gonna walk you through that part. that you actually walk with me as I recover, okay? Because I think that's very important to get that first-hand experience and information on how, and you can see how I'm feeling, how I'm doing, and then I can give you suggestions as to do the recovery. And so I'm very nervous, okay, about the process, but I'm praying, I'm staying faithful, I'm staying, grounded in that everything is going to be fine, and my recovery is going to be fine, but at least the procedure itself is going to be what it's supposed to be. And we're going to get, I'm going to get through this. And I want to encourage you that, if there is a cyst sitting in your abdomen, you want to get it checked out. Don't let it go away. Don't ignore it. You know your body better than even the doctor knows it. So, especially as you being a mom, don't just let things slide, okay? Don't just put yourself on the back burner, because putting yourself on the back burner, one, it will drain you. Two, it will cause you to, put yourself at risk, okay? You don't want to be at risk, all right? Don't put yourself at risk. Do the right thing. And right now, I'm just, I'm making dinner, but I'm also preparing for that day. Okay, so I'll come on here on my other video and I'll share with you how I'm going to prepare for this procedure. But I just wanted to share this part of the journey, what led up to my decision to go ahead and move forward, and hopefully that everything again will turn out fine. I have a great support system with my husband and my mother, my kids. I have friends that will check on me. I have a lot of different support systems in my corner, so I know that I won't be alone, and I'm grateful for that. So, with that being said, I'm gonna go continue cooking my stir fry. All right, and I hope that you have an amazing day. If you have any questions for me about anything else, put them in the comments. I'll be glad to have answer them, either texting, messaging you back and replying, or I'll shoot another video and then I will send you, put the link in the reply or things like that, so that not only can I help you answer that question, but I can also help many other people that are also most likely going to go through this process, or maybe facing the obstacle of should I or should I not. That decision is going to be up to you. I always say you have to do what's best for you, not what's best for everybody else. And make the decision knowing the outcome and that you're going to be okay with the outcome. That's always the key. Not about what everybody else. Don't even let a doctor push you. Once they tell you that you need to get, or they recommend that you do something, don't feel like you're cornered. Listen to what they have to say. Then you go and do your research. Okay, do your research about the outcomes of what that procedure will hold, what to expect, and then you ask your questions, because at this days and time, every doctor has a patient portal where you can inbox them a message and somebody will hit you back. And if they don't, then you need to go find you another provider. And if you don't feel comfortable with your first recommendation, then you go and find another provider and ask them what is, this is what's happening, and they will do their process and trying to figure out what they see, and then they'll make their recommendations. And from there, you make a decision. So you have to do what's best for you. I chose to just continue through the process with my current provider because I've been with them for the past 7-8 years. So there you go. Okay. I know they're knowledgeable. They know my history. They got records from when I was in New York and I moved back to Virginia. So they're very well versed in what it is that is happening with me. So that's what I want to share with you, is make a decision with full information. And if you don't have the information, you find someone or find a trusting person like myself that will put it out here and also will help you find what it is that you're looking for. Because at the end of the day, not only am I a mom, but I am a nurse, not by paper. I'm a nurse in my heart. So I'm here to help serve other people and to, help people find the answers that you're looking for to make an informed decision. All right, so I'm gonna jump off here. You're gonna have an amazing day.